Earlier today, it was revealed that the Ottawa Hospital had to eliminate another 35 full-time equivalents in healthcare. This is on top of cuts at the CHEO Hospital in my city. We know that North Bay, for example, has lost close to 100 full-time equivalents in their healthcare. These are the direct consequences of ignoring deficit reduction targets. It is cuts to healthcare and into education. The minister can laugh all she wants, but the Fraser Institute reported this morning that ballooning public sector salaries have increased by a rate of 47%.
Order.
While inflation has only increased by 15%. Today, Ontario public servants are being paid 11% higher than those in the private sector. So my question is very simple. Can the Treasury Board President tell me how many additional job cuts we can expect in healthcare and education over the next few months as a result of ballooning salaries at the public sector?
Thank you. President, Treasury Board.
So, Speaker, I think this is an important question. We should all favorite this question because it is both a spending and a cutting question all in one. You heard the member opposite say that she's concerned about cuts in health care. In fact, the Ottawa Hospital has had an increase of funding of 49% since 2003. That's over $200 million more. Yes, it's true, the healthcare system is changing, and that does mean changing where people are working and the kind of care that is provided in hospital and out of hospital. But we have a very clear path to balance, Speaker, and we are on that path. It does involve restraining compensation, and if the member opposite would actually look at that Fraser Institute report, she would see that, in fact, compensation has been flatlined for the past 5 years, Speaker, on an individual basis.
Thank you. Supplementary.
Bring Pollyanna back to reality here. The Fraser Institute was pretty clear that public sector wages in Ontario.
We will not accept that. We either mention the person's title or their riding, please, and nothing else.
Treasury Board President isn't being clear with the Assembly or the people of Ontario. We know public sector wages are 11% higher than they are in the private sector. We know, for example, wages have increased 47% when inflation only rose by 15%. These are direct consequences, Speaker, when we see health care cuts and when we see education cuts. Each time a salary raises beyond the level of inflation, there will be compromises to public services that we value.
Member from Glengarry, Prescott, Russell, come to order.
Will the Deputy Premier talk about the deficit that she has rung up with her colleagues, as she did earlier in question period, and talk about the fact that that the increases to public sector salaries are compromising healthcare services in the City of Ottawa and elsewhere in the province of Ontario?
Thank you. President, Treasury Board.
So, Speaker, I don't often quote the Fraser Institute, but if you would turn to page 9 of the report that was released today, you will see that the compensation per provincial government job in 2009 was $76,337. It is now down to $75,960. This is a chart that says our plan is working, that compensation restraint is underway in the public sector in Ontario, Speaker, and that's an important piece ongoing as we get to balance. We are determined to get to balance by 17-18. We're on the path to get there, Speaker. It's not easy work, let me tell you, but it's important we do it at the same time as we protect the services that matter to the people of this province.
Thank you. New question, the member from Toronto.